Hi, everyone, and welcome to The Breakouts, a podcast where we interview extraordinary founders in just under 20 minutes. I'm your host, Akkshay Khosla. Now, you'll find many podcasts out there that are 2 to 3 hours long and interview these wildly successful founders after they've already made it big. But by that point, the founders are already 5, 10, or even 15 years into their journey, so their insights just aren't as actionable anymore. We're doing things a little bit different. We're interviewing founders that are on the cusp of breaking out so that you can learn the playbooks they're using to build category-defining companies today. And we're doing it in just under 20 minutes. Now, just before we get started, go ahead and follow us on Twitter at The Breakouts Pod, subscribe to this YouTube channel, and join our Discord community for aspiring founders. The link is in the description below. And I think that's everything I have for you. So without further ado, here's today's guest. All right, ladies and gentlemen, welcome back to another episode of The Breakouts. Today, we have Nick Desai, the co-founder and CEO of Renee. Now, Nick recently raised a $8.2 million seed round for his HealthTech startup, and it's such a treat to have him here one more time to talk strategies, tactics, and hacks with us. Now, just as we get started, Nick, would you be able to share one more time a little bit about what your startup is and what it does, just as a recap for our listeners that might have missed the previous episode?
Yep. Thanks, Akkshay, for having me on. And hey, everyone, I'm Nick Desai. I'm the CEO of a company called Renee at renee.com, renee.com. We're a personal health assistant that helps older, underprivileged, polychronic, and everyday Americans complete routine healthcare tasks. We take your doctor's appointments, we deliver your medications, we remind you to take them, we arrange labs, we track your vitals, we do all the things that help you if you have diabetes, obesity, hypertension, heart health, COPD, depression, anxiety, to help you achieve better health and spend less time on hold and less time waiting in line and less time being frustrated and wondering why you're not getting better despite all the time you spend in healthcare.
Awesome. Cool. And if our listeners are curious and you want to learn a little bit more about the company and the industry and how Nick thinks about it, please go ahead and listen to the first episode. Now, let me talk a little bit about how we're going to carve up this episode, just so going in, Nick, you have an understanding of the different sections. We're really going to have 4 main sections to this. We're first going to talk about product and how you think about making product decisions. Then we'll talk about distribution and how you think about acquiring users. We'll talk a little bit about fundraising and any tips that you have for early stage entrepreneurs that are looking to put together their pre-seeds or seeds. And lastly, we'll talk about operationalizing your startup and how you find efficiencies in terms of your work and your team's work. And I'm a little bit of a nerd for that, so I'll definitely be excited for that last part. So just to start off with product here, could you tell us a little bit about the beginning of your journey, right? When you first experienced this problem, you told us a story about this in the first episode, but I'm curious, from experiencing the problem to getting it to the point where you have a lot of conviction in it, that you're ready to dive in and build a business around. What were some of the steps that you took during that process to make sure that, hey, you're confident enough in the problem and your approach to the problem that it's time to go start a company?
Well, look, we are veteran health tech founders. Renee and I, my wife and I, are veteran health tech founders. So we knew coming out of our last company, Heal, and we knew from our own personal experience as caregivers to our aging parents that we that the caregiving space at the sort of digital health assistant or digital care journey or care coordination space is a quagmire that really is a greenfield opportunity. Part of that is regulatory, because it was only this July 2022, when the Cures Act finally made digital health records interoperability a requirement, and only really January 2023 when TEFCA goes into effect and makes it possible for services like ours to get people's health records. So it has, and in a post, and then if you think back, digital health sort of got going 2015, 16, 17, 18 with telehealth and stuff like that. Then a pandemic came along and it got accelerated, right? Everyone wanted telehealth. No one wanted to get COVID by going to the doctor's office. And that was great. But now we're while COVID hasn't gone away, we're acting like it has, and we're living a post-COVID world per se. And you'll see numbers dropping, and lots of companies are having trouble getting patients to use their digital health services. And the problem that we see is that those services are disconnected, fragmented, siloed services, and not connected and not unified and not easy to use. And let me give you an example. Let's say you're an average 65-year-old in America and you have diabetes and you have hypertension. Okay. Just those two things. Okay. You probably have underlying obesity and maybe mental health issues too, but just take those two things. Now you're taking 7 daily medications. You have 3 different doctors involved in your care. There's digital health tools, and you could sign up for one to do telehealth, and you could sign up for one to deliver your medications, and you could sign up for one to track your vitals, and then you could get an Apple Watch to look at your heart stuff, and then you could take your doctor's appointments, and none of these services would talk to each other. Some may work with your insurance, some may be cash pay, and none of them are coordinated in any way. What real person wants to do that, right? What we set out to do is do what real people want, which is everything is in one place. They direct it, they drive, and we take care of everything. And it's all coming together because your blood pressure and your diabetes and your heart disease are intricately related to each other. So their care should be related, and everything should happen all in one place in an incredibly easy to use interface. And so that is the problem we're trying to solve, and that's how we approach it.
That makes sense. And I think there's one piece there that was really important, which I'm going to try to highlight. That part where you talked about legislation and how there was a greenfield here. It seems like that was one of the steps to building conviction, because typically if there's legislation that is blocking new software and solutions from being able to tackle a space, as soon as that legislation opens up, or in this case, enforces that interoperability, you then unlock a large number of use cases and you automatically have the answer to, hey, well, why wasn't this done before, right? So that's really cool. Moving on from conviction, right? When we think a little bit about product strategy, if you were to pick one objective that you have, right? You guys are pre-launch right now, you have beta testers and you're gearing up for a launch in the next few months. Could you pick out maybe one major objective and then talk about how you're thinking about achieving it? So it could be one OKR that you have or one large goal, whatever works.
Yeah. So first, I don't know when this podcast will air, but we launch on October 4th in 2 weeks. So it's coming up, right? We're with the finishing stages. Core objective, the first core objective is to get people to actually subscribe, right? The first 3 months, we want to get 1,000 subscribers, make them very, very happy, earn a net promoter score over plus 75 on those 1,000 subscribers. Those are the 2 core objectives, right? Because we know that we've built a product that serves people needs, and that was a core objective. And so we went through the AARP HealthTech Accelerator, and we were actually able to ask 1,100 seniors exactly what do they want a health assistant to do. And some of the things are the things you would guess: deliver my medications. That was at the top of the list. Some of the things are things you wouldn't guess, right? I did not put as much of a premium myself on scheduling doctor's appointments because I don't see that. I'm married to a doctor, and so I don't have to run around and see doctors as often as the average person, I suppose. But that's scored very high. So we know that we're building a service that people that handle the things that people want handled. We know that the interface is easy to use because went through a pilot and a beta program. Now we want to make sure people are willing to pay for it. The cost per user acquired is manageable, right? It's within reason, and that the people who use it are happy. And if we show that by the end of the year, we've really done something.
I think you articulated that really well. So you guys are shooting for getting 1,000 users to adopt your product, an NPS greater than 75 as a measure of how happy these users are. And you guys are also assessing whether they're willing to pay for it. I think one thing that's really interesting that you just said was you got inputs from roughly 1,100 seniors about what kind of features they would want in this, what pain points hit the hardest for them. And I think 1,100 is a sizable amount, right? That kind of data is really useful for informing product decisions. But one of the biggest challenges for early stage founders is how can you even get data at that scale, right? You can go conduct 20, 30 user interviews and it might take you a couple of weeks. But how did you guys get 1,100 data points?
That's why we've partnered, right? And my hack there, if you want to call it a hack, is
Mhm.
go find an accelerator. People think of Xtrailers as Y Combinator and Techstars and 500 startups and whatever, and those are all great. But there are a lot of vertical accelerators that are smaller, that
Mm.
don't necessarily even invest in your company, right? The AARP actually did invest in our company, which was really cool, and it's a huge endorsement. But um, leave that aside. They don't, but they can give you access to things that you can't get access to that are critical for your product or service to succeed, right? In this case, what the AARP was able to give us was access to 1,100 seniors, and to do surveys with them, multiple surveys with them, to help us understand exactly what patients want.
Gotcha. Very interesting. So I think that's a really interesting hack, which maybe doesn't get talked about enough. But if there are associations of your target customers, going and finding those associations, seeing how they can benefit and proposing to them, hey, can we just talk to some of some of your members or some of the people that you're looking to serve? I think that's a great takeaway for our listeners. Moving on a little bit, I'm curious, let's talk a little bit about distribution. If you were to articulate your customer acquisition strategy and kind of what are the different channels, paid, organic, word of mouth, et cetera, how would you break that down?
We ultimately, the growth of any great D2C subscription service has to be word of mouth. It has to be word of mouth, right? Especially for a product like this that caregivers and family members would talk about, right? Now, we want to jumpstart that with organic and earned media, right? So PR and purchased media, with offers and lead gen partnerships and ads and things like that. But ultimately, if we don't get to sort of sustained organic virality, right, where one user turns into many users, right, then the problem becomes that you're always chasing your tail on customer acquisition cost, and ultimately you don't end up in a good place, right? You don't end up with a sustainable, independent business model, and so many companies are seeing that, right? So to us, the threshold for greatness is: are we acquiring patients, members to this service at an effective cost, and that cost blended, including the total number of users divided by total spend, et cetera, works out to a number that we can live with, and that reflects that there's virality. By the way, reflects that there's a great product as well.
That sounds really interesting. I'm curious, what key components do you think about when you're calculating your fully baked CAC?
So the CAC that you report is, direct cost per user acquired. So if I spend $50 if I spend ads and I do pay per click and it's $10 per click, so it's $10 to get to my website, and 10% of those people sign up, well, my cost per user acquired is $100, right? Great,
Right.
easy enough. But the way I look at it is, if I do that, but I'm also doing some PR, I'm also doing organic social, all those things cost money. So at the end of a month, yes, it's important to look at that direct CAC number, but it's also important to look at: what was my total marketing, goodwill, business development, free trial? What was the total spend? Okay. So now
Mm.
I look at it and go, okay, I got 1,000 people to sign up, and some of these came directly, and some of these this, and some of these this. But the total amount of money I spent, some of these were organic, whatever. I spent a total of 20 grand, and I got 1,000 people to sign up. Okay, it's $20 per person, right? That's
Mm.
the ultimate math that you have to look at, because the CAC LTV numbers that VCs look at, yes, are dependent on the direct number, but I think that the blended number is where you want to look at, because it's also how well are your users. That's where you'll measure virality. Ideally, you want the total cost, average cost per user acquired, substantially less than the direct cost per user acquired, because it means your earned media and your word of mouth are working for you.
Right. And what kind of is that ratio, just for our listeners? From what I've heard, it seems like a 3-to-1 ratio in terms of LTV to CAC is usually the bare minimum these days for subscription businesses. But I'm sure the best companies go even higher, right?
Yeah, I think you have to build for higher. I
Hmm.
think you have to target 6-to-1 or 8-to-1 LTV to CAC ratio, and you have to be realistic about your LTV, because the easiest way to get there is to say, my churn will be nothing, and my users will be on the system for 5 years, and then great. Your LTV to CAC is 0. You know what I'm saying? And I mean, or
Right.
10 or whatever it is, right? I think without smoking your own crack, as I like to say it, you have to, don't smoke other people's crack either. But the point is, um, you have to be able to deliver on a 6-to-1, 8-to-1. That's where your target has to be, because there's always going to be cost. Everything gets more expensive. Everything is more difficult. One of the mistakes that companies make is, it's actually, people say, oh, there's a saying in politics, all you need is one vote and the rest are for ego, right? That may apply to politics. It doesn't apply, right? People say that economies of scale start to work, and the more people you acquire, the lower the cost gets. It's actually exactly the opposite. Anyone can go find it, not anyone. Any decent service can get 1,000 subscribers, right? Okay, I did it. I hustled. I knocked on my neighbor's door. I called everyone I know. I begged my friend. I got 1,000 subscribers. That and the initial PR and your VCs emailing people, all that stuff, great. Boom, done. What is sustainable, right? Can you, on an ongoing, does that same method get you to 10,000, to 100,000, to 1,000,000, to whatever number you want to ultimately build you a big business? Is that a number that you can live with, right? So I think it is easy to look at early CAC and say, oh, this is great. Yeah, but that's the day you got covered in TechCrunch and Fierce and the information. All these people covered you and said, great, check out Renee, great. Bunch of people came and signed up, great. Ooh, our CAC was 0. Okay, well, cool. Except it's really not. So you have to make sure that you are very, 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 very careful about how you measure, and does the measurement scale on a sustainable basis.
That's really insightful. So in terms of acquiring customers, what is one distribution hack that you think is unconventional, a little clever, something maybe you're proud of, that you've either utilized or have found really impressive in potentially even another company?
I think there are a couple of things that I have done well, that sometimes startups don't pay attention to as much. One is PR, traditional, having a PR firm, a PR person, firm, whatever it is, that is out there pounding the pavement for every piece of earned media coverage. People still trust what they read, and not an ad, but an article. And if you take the time and you do the PR and you do the podcasts and you talk to the online, and it doesn't matter, big, small, yeah, everyone wants, I was on CNN and I was in Wall Street Journal, whatever, great. But really, it's just continued perseverance. The second thing is related, which are awards, right? And awards, nobody funds you because you are a Fierce 15 company or a Rock Health Innovation this or a CNBC Disruptor that. Nobody funds you for those. I won all those awards. Nobody writes you a check for that. They might take a meeting because of that. They might reach out but that's not why. But those things feel like endorsements they add credibility. There's a lot of different things competing for people's dollars, and they're going to make a choice. This one versus that one versus this one versus that one. And so I think that those are two things that work very well, right?
So investing in PR relations can be a company's distribution hack per se.
Yeah, it can be. It's not going to carry the water by itself, right? And then the third one, which sounds really old school, is, and it applies only to certain industries, and we're in one of them because we're really focused on older, aging Americans and people over 50, is just old-fashioned calling. Call people, and not in a spammy robocall, not like that, but calling people, right? Hey, this is Nick. I'm calling from Renee. I saw you were on our shopping cart. Do you have a minute? And well, yeah, I didn't sign up because I had some questions. Well, can I answer them for you? Right? Just that phone. Yes, it may be expensive, but you know what? Oftentimes startups have all these people that are sitting there after they launch and doing all these online mechanisms and sort of waiting for the traffic, and you're, ooh, what happened? What happened? Why not just take every phone number you can find and call the person, right? People still love a one-to-one outreach. They love the conversation. They love the opportunity to have a relationship. And I think that's another one we've used successfully, right? It never hurts to, the worst thing they're going to do is not answer the call. So what?
Very
Don't
cool.
spit on you, right? I mean,
they can't, right? So, very cool. Awesome. I think that those are some great takeaways. Moving on to our last section, let's talk a little bit about operationalizing your business. Now, for early stage founders, execution is key. I mean, early stage, late stage, every stage, execution is so important. What are some tips you can share? Maybe just one or two pieces of advice or one or two hacks that you have personally used to make your operations more efficient?
So the first thing is be metrics driven from before you launch, right?
Mm,
Don't wait till after to go back and say, wait, what happened, right? Plan for the metrics you want, integrate, and then measure, right? That's a critical one. You can't improve operations, sales, any part of the business without knowing what happened, right? I have been saying if you can't measure it, it doesn't exist, right? That's my
right.
basic like saying. The second thing
Mm,
is you don't have to get overly fancy on tools, and companies try to do this. I'm going to sign up for Monday.com for this and Tuesday.com for that and Wednesday.com for this and Thursday. And you end up spending more time maintaining all these freaking tools and systems than you do getting value out of them. You know what works when you're small? Google Sheets works when you're small, right? Everyone in the company can share. You can put information there, keep track of stuff. Old fashioned, look at customer by customer, look at member by member, review them on a daily basis. I think to do it small operations, you do it as old school as possible and then figure out the right systems for you. Because here's the
mm,
thing, no matter what you think, the systems you think are going to be the right systems to manage your operations or not. So do it old school, don't spend money, and brute force it, do it yourself, and then learn and go, okay, what we really need here is this kind of tool or that kind of tool. Okay, great, then go get it.
fascinating. I think you really hit the nail on the head there. I think it's really important day one to go through all the motions yourself so you understand the nuance, the complexity of exactly what it is you're doing, and then figure out a way to help it through tools, through automation. I think that's really well put.
At Heal, we, through our first 100,000 house calls delivered, literally 100,000, I did the customer service phone calls. Now,
Wow.
thankfully, the Net Promoter Score is very high and most people loved it, but I personally handled customer service phone calls and emails. I was the CEO of the company. At that point, there were 100 people, including doctors, engineers, blah, 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 whatever. We were operating in 5 states. We had plenty of funding, but I did because it was the best way to stay closest to the product was to talk to the people who had a bad experience, right? What went wrong? Okay, well, I can go test. Oh, you're saying that button doesn't work? Let me go test it, right? And I'm the guy who could send the email that says fix the button that people have to listen to, right? That sort of comes with my job. So the point is, there's a tremendous value to staying close to your customers and eating your own dog food and listening to it, right? Oh, and that would be the other thing. Use your product, right?
Right.
I'm putting all my stuff in Renee, and Renee's
Mm,
going to deliver my medications and take my doctor's appointments, and so I'll know when it doesn't work.
awesome. Yeah, I think that was really insightful. Well, hey, and Nick, we're coming up right on time here. Thank you so much for all the insights you shared today. It was such a treat to have you on. If I may say so, I think you've been one of our best guests so far. Hopefully, maybe one day we'll get to have you again. It's been such a privilege. Just as we wrap up here, are there any plugs that you want to make? Are you hiring? Are you looking for customers? Feel free. The stage is yours.
Yeah, thanks for having me on. Thanks for the nice words. I want anyone who's listening that finds this interesting to visit renee.com, renee.com. It's as easy as that. Check out the service. If you're a caregiver, if you have chronic health issues, sign up. You'll like it. I promise you. And if you don't,
Awesome.
I'll call you for customer service.
Awesome. Well, if you want an easy way to speak with Nick Desai, sign up and complain about the product, guys.
There you go. There's a hack.
And lastly, for our listeners that may want to follow you, what's the best platform to do so?
Just LinkedIn. I'm just look for Nick Desai. There's a bunch of Nick Desais on LinkedIn. I'm the one that built Heal and is now currently CEO of Renee. It's easy to find me, and I connect and I try to message and I try to be helpful to entrepreneurs wherever I can. A lot of people reach out. Can you read my business plan? This, that. I make as much time as I can, within the context of running this company, being married, and having 3 young kids that, are my pride and joy. So
That's awesome. Well, there you have it, folks. That's today's episode. Nick, such a pleasure to have you on. We will see you all next time at the breakouts. Thanks, everyone. Bye-bye. All right, and that wraps up today's episode. We really hope you enjoyed it. Now, just before I let you go, I wanted to reiterate one thing. We're trying to build the best podcast out there for aspiring entrepreneurs, and to do that, we need your help. The best way you can help us is by joining our Discord community. The link is in the description below, and then leaving us feedback. Tell us how we did. Tell us how we can improve. We're eagerly waiting to hear from you. Other than that, show us some love and follow us on Twitter at The Breakouts Pod. And I think that's everything I have for you. We'll see you next time on The Breakouts.